today's topic: is absence of morning sickness a sign of miscarriage?
As you may have heard, women who have morning sickness have a statistically lower risk of miscarriage.
With that in mind, it's easy to start worrying that it's a bad sign if you have no nausea or vomiting.
If I have no morning sickness, is that a sign of miscarriage?
Lack of morning sickness is not considered a symptom of miscarriage.
Although many women do have nausea and/or vomiting during pregnancy, many others have perfectly healthy pregnancies without any nausea at any point. In addition, it is not unusual for morning sickness to come and go, so fading morning sickness is not necessarily a sign of miscarriage either.
Thus, you should try not to overanalyze your pregnancy symptoms.
Fluctuations in pregnancy symptoms are normal, and there is a huge variation among women.
But if you are worried because you're having symptoms of miscarriage, or if you continue to feel nervous, talk to your doctor to see if there's any way you can check that everything is alright so that you can feel reassured and relaxed.
What is morning sickness?
Morning sickness is nausea and vomiting that typically occurs during the first 3 or 4 months of pregnancy and then usually stops on its own. However, morning sickness can occur at any point during pregnancy.
Although morning sickness usually poses no risk for the mother or fetus, it can be pretty uncomfortable.
Morning sickness is exceedingly common among pregnant mothers.
Most expectant mothers have some nausea at some point during the pregnancy, and a third of pregnant mothers experience vomiting.
Morning sickness can become a more serious problem when the mother has severe vomiting and loses considerable weight. However, a little weight loss and morning sickness during the first trimester is less concerning. What causes morning sickness?
We don't know exactly what causes morning sickness. Morning sickness may have something to do with hormone changes experienced during pregnancy or low blood sugar levels.
Factors like stress, travel, and fatigue can all make morning sickness worse.
On a related note, just because a woman experiences morning sickness during one pregnancy doesn't necessarily mean she will experience morning sickness either at all or in the same way during the next pregnancy.
How is morning sickness treated?
Unfortunately, there's no specific cure for morning sickness.
Typically, morning sickness goes away after 3 or 4 months of pregnancy. Here are some tips on dealing with morning sickness.
Drink plenty of fluids.
Avoid large meals and snack often.
Eat a little once you wake up and right before you go to bed. Think dry toast or crackers.
Eat food rich in protein and complex carbohydrates. Think peanut butter, apple slices and cottage cheese.
Try ginger products to decrease nausea, think ginger tea and ginger candy. Don't smoke.
Keep air circulating in your house and reduce odors.
Speak with your physician about taking vitamin B6 supplements.
Try consuming bland foods when nauseated, like broth, gelatin or crackers. Consider using acupressure wristbands or trying acupuncture. Most people don't need prescription medications, like Zofran, for the nausea of morning sickness.
However, feel free to discuss anti-nausea medications with your physician.